In the Gaza Strip, Israeli forces are pressing their offensive further south, where Israeli Prime Minister Benjamin Netanyahu said they aim to take control of Gaza's border with Egypt. In the last 24 hours, airstrikes and artillery fire there have killed dozens of civilians, according to the Hamas-run health ministry. And that has put even more pressure on displaced Palestinians seeking refuge from the violence.
As Israel plans to take control of the area around Gaza's border with Egypt, displaced Palestinians cram the streets of Rafah, the town right next to that border. They have come here to escape intense fighting in south and central Gaza. They flee with just the bare essentials. Everyone is looking for shelter, and space is running out. We came here 20 days ago. We couldn't find any place to put a tent, so we're staying at the stairs of the mosque. The situation is tragic. We don't have drinking water, we don't have food. The kids wake up in the morning wanting to eat without water to drink. It took us 1 hour to find water for them. We could not find flour. Even when we want to take them to the toilets, it took us an hour to walk there. Aid organisations are struggling to provide basic sanitation facilities to cope with a rising number of people in Rafah. These 40 stalls serve an area where many hundreds now live. Adding to the spiralling humanitarian crisis, the war continues. In central Gaza, rescue workers race to find survivors at the Maghazi camp after Israeli strikes in the area. And Israel's army is pushing into the southern city of Khan Yunis as they try to eliminate Hamas, which is widely considered a terrorist organization. As the intense conflict moves further south, displaced Palestinians are running out of places to flee.
Well, Ahmed Bayram of the Norwegian Refugee Council is based in Amman, Jordan, and joins us now. What's the latest you're hearing from your colleagues in Gaza? What's the situation like there for people as Israel steps up its ground assault?
Good morning. The situation is quite horrifying in terms of more displacement, people moving from the central areas to the south. There's a massive outbreak of diseases, people falling sick in symptoms that no one can try to find out what these symptoms are, because there's no capacity, there's not enough doctors, and there's no medication for these people. We're talking about 20% now of people who have fallen ill in Gaza. That's 400,000 people. Our teams, of course, communication has been down for quite some time now, so we can hardly get a word in or hear what is going on exactly. Besides that, our teams are alive. Even the aid situation now is deteriorating. We had some hope after the Security Council voted for more aid, but we don't see that materializing on the ground. And of course, UN agencies and others have raised that flag as well. So our teams are working under some of the most impossible conditions, without enough food for their own children, without enough water for their own family. And my team has now, my colleagues have learned how to construct a tent and the latrine now. This is what, situation has been reduced to. This is what life has been reduced to in Gaza.
The UN Agency for Palestine Refugees has estimated that more than 40% of Gazans are at risk of famine. How much food can you actually get to those people most in need?
Not much. Without getting into this game of truck counting, even though yesterday, for example, we only had 100 trucks, and of course not all of them will be bringing food for people, but you're talking about a constant state of hunger that now families of 3 or 4 children have to choose who is the hungriest to give them the next tin of food. Now, people have to queue for long time to get hold of a bag of bread, if that is even available. And of course, we're talking about probably, when this hopefully eventually ends, this crazy level of violence, when all this ends, we will be looking at some of the most horrific malnourishment numbers that will take probably months and years to overturn. So now we are genuinely worried about children consuming very, very little food and consuming contaminated water. This will create a health disaster for months to come, really, in Gaza.
Ahmed Bayram of the Norwegian Refugee Council in Amman, thank you.
Thanks.